Hello, my name is Kayla Lopez, and today we will be discussing the relevant ethical issues in research surrounding communication, the principles of what encompasses scientific communication, ethical implications in human research as it applies to allied healthcare professionals, ethical issues that one may face around communication when conducting research, how to communicate effectively and appropriately with patients, family members, and other healthcare providers within the interdisciplinary teams, and an explanation of how to appropriately demonstrate effective skills in writing a formal correspondence to communicate information and ideas thoroughly. The principles of scientific communication are centered around appropriate, concise, clear, accurate, and transparent information that is integrity based in the development of science and the expansion of the scope of knowledge and practice. When discussing methods, they must be delivered like recipes because they enable others to approach them with the capability to develop and bring the communication to fruition. In an article by Susie Spitzer, explains 5 principles of science communication. It highlights the importance of assembling a diverse and interdisciplinary team. The essential quality to attain effective communication is to distribute a foundation of decision-making power fairly to all involved. Creating this foundation highlights collaboration and provides a commonality between all team members. The next principle highlighted is to tell a story, like a recipe. When collaborating to build communication, it is important to provide a clear and concise story to enable others to build on. Enabling others can be created by making a message personal. This principle allows one to create an honest and accountable environment. This allows for the next principle of communicating with other team members rather than toward them. Face-to-face interactions, shared experiences, engaging the public, and listening to others' input helps team members make their research more socially valuable and comprehensive. Using the 4 principles previously stated allows one to practice the final principle of being a human first. It is essential to who they are and where they come from to enable others to build trust to use the expertise context within the scientific research. Using the principle of scientific communication, researchers can implement ethics within their practice. Researchers can use honesty, integrity to develop evidence to initiate plans, communicate effectively, and advance practices. This allows the process of ethics to play a significant role in healthcare. Ethical implications play a substantial role in human research because they enable allied healthcare professionals to navigate complex ethical considerations while upholding principles of ethics such as beneficence, justice, autonomy, and non-maleficence. To further explain, beneficence signifies the act of promoting the well-being of patients. Non-maleficence encourages the act of not harming. Justice is providing fair treatment, and autonomy is the act of allowing patients or participants to have a say in their care and encouraging them to have control over their decisions by providing all necessary information. An ethical issue can be defined as any situation that may compromise in whole or in part the respect of at least one moral value. For this reason, allied healthcare professionals need to abide by ethical implications such as informed consent, protection of participants' rights, welfare, privacy, beneficence, and non-maleficence, also managing conflicts of interest and respecting diversity and cultural sensitivity, and provide a continuous ethical oversight that ensures research protocols are ethically sound. Utilizing ethical implications and principles in research practice allows allied healthcare professionals to contribute to the ethical code of human research and promote the well-being of patients. Participating in the ethical code promotes collaboration with interdisciplinary teams, ethics committees, and institutional review boards to further the scope of practice of each allied healthcare professional. Ethics committees and institutional review boards were created to avoid critique and fix any ethical issues found and included within research. A peer-reviewed research journal by author J. Drolet synthesized 10 units of emerging ethical issues around communication research, which included research integrity, conflicts of interest, respect for research participants, lack of supervision, power imbalances, individualism and performance, inadequate ethical guidance, social injustices, distributive injustices, epistemic injustices, and ethical distress. When conducting research in the allied healthcare field, Ethical issues around communication are substantial due to the sensitive nature of the information and its impact on society. Ethical issues may arise unintentionally, such as when communicating to obtain informed consent. Allied healthcare providers must ensure that participants fully understand the purpose, risks, benefits, and procedures before consenting the participant. The healthcare industry is an extremely stressful environment not only for providers but also for patients. High stress environments usually result in mistakes that breach ethics such as privacy and confidentiality. To maintain ethical standards such as justice and non maleficence, it is important to communicate how participants' data will be collected, stored, and used because breaches can diminish participants' trust when participating in research. This extends to how the research process is disseminated to various stakeholders, participants, healthcare providers, policymakers, and the public. Researchers must communicate clearly and accurately to avoid sensationalism or exaggeration and acknowledgement of the limitations and uncertainties within the subject being researched. To diminish ethical issues that arise in communicating research, it can be effective to engage with relevant stakeholders such as community members, advocacy groups, and other healthcare organizations to promote meaningful feedback and encourage accessible research to diverse audiences. Addressing ethical issues within communication and research within the allied healthcare field can foster trust in communities, encourage transparency, and uphold the well being of the participants and community. To promote ethical and moral values within research, it is important to relay research effectively and appropriately. To communicate effectively and appropriately, it is important to understand your audience and communicate in a diverse manner that respects multiculturalism. Effective communication is an important component of quality patient care. It is important to utilize interpersonal skills and address barriers aligned with the concepts of patient centered care. Establishing rapport and trust is vital to ensuring you communicate effectively. Patients and research participants require a trustworthy relationship to feel supported and advocated for and respected. Body language, eye contact, and a welcoming environment are important aspects of establishing trust early on. Effective communication does not always involve talking. It is essential for allied healthcare providers to actively listen by providing full attention to the speaker, focusing on the tone of their voice, and utilizing nonverbal cues. Active listening opens the dynamic of being empathetic and compassionate towards the audience. Providing empathy allows the audience to feel respected and dignified, enabling them to feel that their cultural differences and personal preferences are being respected. Utilizing all these tools adopts a patient-centered care approach. It encourages patients and families in decision making, soliciting their input, respecting their preferences and values, and encouraging patients to ask questions, voice concerns, and participate actively in their care. Communicating effectively and appropriately opens avenues for patients to build trust in the overall community of the allied healthcare field, which can be intimidating at times due to the fancy terminology, complex explanations of healthcare research, and the intensity of scopes of practice. Because of this, allied healthcare professionals need to demonstrate effective writing skills in formal correspondences to communicate information and ideas. In doing so, healthcare professionals need to know their audience. Effective writing skills conveys information and ideas clearly, professionally, and appropriately for the intended audience. To maximize effectiveness in writing formal correspondences, it is important to be direct, speak directly to your audience, revise information repeatedly, and encourage feedback. Identifying your purpose and audience before writing allows one to set the tone, style, and content. Setting the tone and style promotes being courteous and respectful throughout the correspondence, regardless of the nature of information being communicated. If addressing a problem, it is important to be solution-oriented and provide only relevant information to maintain clarity and being concise. Staying concise comes with proofreading and revisions. Following up on revisions allows one to adhere to formalities and protocols, encourages diplomacy, and maintains positive and constructive dialogue. Addressing ethical issues in research surrounding communication with allied healthcare professionals is paramount for maintaining the integrity of the research process and ensuring the well being of all stakeholders involved. Effective communication requires transparency, respect for privacy and confidentiality, cultural sensitivity, and a commitment to all ethical principles. Ethical, ethical communication is a safeguard that enhances the credibility, validity, and impact of advancing healthcare knowledge and practice. Thank you.